Welcome to Eye on America. I'm Michelle Miller. Today we see how Americans are grappling with a wide array of issues in our healthcare system. In New York, we look into the economic burdens associated with IVF treatments. And in Arizona, we spotlight an organization offering emotional support to overworked family caregivers. But we begin with rising concerns affecting our nation's elders. More than 70% of nursing homes in the U.S. are owned by for-profit companies. New research is raising troubling questions about these facilities' quality of care. Lisa Ling shares how her own family's experience is part of a wider, worrying trend.
This is Berkeley East, a for-profit skilled nursing facility in Southern California where my 92-year-old mother-in-law, Grace Song, spent a month after a hospitalization.
When you go through all this stress, I'm just so deadly tired.
I began recording her during my visits after she told me she struggled to get the attention of staff, and medication she says she was told to take promptly at 8 a.m. routinely came hours late.
So then you're starting to panic because so much time is
passing by. So I was pushing the bus to find out what's going on.
One night, my mother-in-law, who was a fall risk, was left alone in the bathroom and fell. She hit her head and was sent back to the ER.
This is where you feel, how did I get to be so helpless?
More than 70% of U.S. nursing homes are now run by for-profit companies, and there's growing evidence patients are paying the price. Harvard professor David Grabowski is an expert on nursing home policy.
The vast majority of quality problems in the U.S. are centered in for-profit nursing homes.
Most U.S. nursing homes rely on taxpayer money from Medicare and Medicaid. Grabowski told us as profit-seeking investors have poured in, it's become more difficult to track where the money goes.
We really don't know kind of how they're using public dollars and whether they're actually going into direct resident care.
What is clear from federal research, many of these facilities have been found to have lower staffing and worse quality of care. In 2019, Berkeley East was taken over by a for-profit company called Aspen Skilled Healthcare, a mid-sized chain of more than 24 nursing homes.
How often were you exposed to examples of gross negligence?
It felt like on a daily basis.
This nurse, who asked to appear in shadow, left Berkeley East after working there more than a decade. She was one of 5 current and recent former employees who told CBS News patient care had been compromised after Aspen took over.
What would you say the biggest changes were?
When we tried to call upper management, they wouldn't even pick up the phone or call us back. They would just leave us short on the floor.
Berkeley East has racked up so many serious quality issues that regulators say it requires special oversight to protect residents' health and safety, and dropped it from an overall 4-star rating to 1.
Labs weren't being reported in a timely manner. Patients weren't given their medications on time.
She also alleges that during the pandemic, Aspen took steps to conceal staff shortages from the state health department by listing names of nurses who appeared not to be working there on internal staff reports.
These nurses were nowhere to be found in the system.
While Berkeley East operated at a loss, data from its most recent financial records show overall Aspen's facilities reported more than $27 million in annual profits.
Where do you believe that money was going?
It was going to corporate.
My mother-in-law wasn't the only one who felt ignored. On one visit, her roommate said she couldn't find staff to change her.
I have no idea when she's coming back.
We continue with our look at nursing homes that may have neglected patients in pursuit of profit. Here's Lisa Ling with part 2 of her report.
That's where all the complications started at Oakland Heights.
Oakland Heights is the nursing home where 85-year-old Ruby Frazier spent a month after a fall sent her to the hospital in November 2022. Her granddaughter Maisha and daughter Yolanda told us Ruby struggled to get the attention of staff.
My mom would push the button for help, and they wouldn't acknowledge her.
How often was she telling you this?
Every time.
All the time.
Maisha and Yolanda say they watched as Ruby's condition quickly deteriorated until one visit when Ruby, who was bedbound, began gasping for air.
I said, would y'all please call the ambulance? No, we're not going to call. I said, yes, you are.
Emergency room doctors diagnosed Ruby with pneumonia and severe sepsis. She had also developed these bed sores on her heels, wounds the family says Oakland Heights staff hid from them.
They wouldn't even turn on her. It's like they didn't give a doggone.
Oakland Heights is operated by Aspen Skilled Healthcare, a for-profit chain of more than 24 California nursing homes. Our CBS News investigation found in 2022, Aspen facilities moved more than $25 million, much of it Medicare and Medicaid reimbursements, to companies related to Aspen.
Nursing home ownership has become very complicated.
Last year, the Biden administration forced individual nursing homes to disclose more information about their owners. But Harvard professor David Grabowski told us that still doesn't explain where taxpayer money is flowing.
Does Aspen have particular investors? There's no ability to peel that back with the federal data. Basically, we need to know for every nursing home in the country how they're spending public dollars.
Research suggests within the nursing home industry, extracting profit through payment of inflated rents and management fees to related companies is widespread.
So how did things change when Aspen took over operations?
For the most part, I would say the care became suboptimal.
Dr. Takeshi Matsumoto is a private physician who sees some of his patients in this LA nursing home, which Aspen took over from a nonprofit in 2016.
Just taking care of some basic needs, like, for example, taking care of the residents' dentures. The dentures were still caked with old food.
I just feel like she suffered.
Maisha and Yolanda told us Ruby's wounds never healed. She died last year, 5 months after she left Oakland Heights. They've sued Aspen, alleging the company knowingly and deliberately understaffed and unfunded Oakland Heights to maximize profits at the expense of patient care.
If you had an opportunity to address the folks at Aspen Skilled Healthcare, what would you say to them?
What if the shoe was on the other foot? If it was your loved one and your loved one wasn't being treated correctly?
Coming up, the push to make expensive IVF more attainable for the average family. This is Eye on America. Welcome back. For decades, in vitro fertilization has been helping women who struggle to conceive naturally have children of their own. But the soaring cost of treatment places a high financial burden on many aspiring parents. Just one round of IVF costs $20,000 on average in the U.S. Nikki Batiste speaks with one woman about her challenges accessing the procedure.
To my future baby, know that you are so wanted.
Nearly every dollar Mary Delgado had was riding on one shot at IVF.
Today is day 3 of my STIMS medications.
3 years ago, while she and her longtime partner Joaquin Rodriguez were trying to conceive a second child, Delgado, who is now 35 years old, learned she had severe endometriosis, a common cause of infertility.
I was broken. To be told that I'll never, ever get pregnant again, naturally. So the doctor told me the only solution for you is IVF. And I knew IVF was expensive.
Delgado was on Medicaid after leaving her job to care for her now 10-year-old son who was conceived naturally and has a rare genetic disorder.
I knew Medicaid was not going to cover IVF. All that ran through my mind was the dollar sign. That's all I thought about.
Is it fair?
No, I don't think it's fair because they don't want the poor to reproduce. I don't think it's fair.
The cost for one round of IVF is $20,000 on average, and it generally takes 3 IVF cycles for a woman to have a baby. In most states, Medicaid does not cover any fertility treatment costs. But in New York, where Delgado lives, Medicaid currently does cover some of the medication needed to do IVF. Delgado found a clinic 4 hours away that offered a discount and a payment plan.
I took out a $7,000 loan with them, and that was to be paid back in the course of 2 years.
To the clinic?
And I spent about $3,000 in medication, and then genetic testing, that was another $2,000. So in total, I spent $14,000.
We need to bring the cost down.
Democratic Senator Tammy Duckworth, who conceived her own 2 daughters with IVF, is fighting to pass legislation that would give more Americans fertility benefits and lower the costs.
Why would we prevent Americans from being able to, fulfill that dream of holding their own baby in their arms?
Currently, 22 states plus Washington, D.C. have passed fertility insurance laws. 15 of those state laws include IVF coverage requirements, and 18 cover fertility preservation, which includes saving a person's eggs or sperm from infertility caused from chemotherapy, radiation, or other medical treatment.
That doesn't mean that everyone in that state will have coverage. Sometimes it's partial, sometimes it's none. There's still this large gap that exists.
Dr. Asama Ahmad is the co-founder of Carrot Fertility, a company trying to close that gap by helping more than 1,000 employers globally provide fertility benefits, including coverage for IVF, fertility preservation, postpartum, and menopause care. Across the country, 45% of large companies offered IVF coverage last year, up from just 27% in 2020.
Is it that fertility coverage is expensive? Is that why it's not so more readily available? Or do you think it's just that we haven't caught up yet and recognize that a lot of people need the treatment?
I think that the issue is that when people think that someone needs to do fertility treatment to grow their family, they consider it as an elective procedure. Infertility is a disease, and some people need to do fertility treatment to grow their family. There is no other way to do it.
There you go.
For Delgado and her partner, 1 round of IVF was money well spent. Their daughter, Emiliana, is now 14 months old, and their $7,000 IVF loan is paid off.
She was definitely worth it. Definitely worth every single penny, because she came to fix my broken heart. She really did. Because I was so fearful I would never, ever get pregnant.
What do you want viewers to take away from your story? What's your message?
That we all deserve a chance, no matter who you are, no matter your race, no matter your economical status.
We turn now to a series of popular drugs for which doctors continue to find new uses. Weight loss drugs like Ozempic and Wegovy are now showing signs they can reduce the craving for alcohol. Janet Shamlian examines this surprising development.
You want to see this tree?
Megan Johnston started taking semaglutide last year. That's the medication in weight loss drugs like Wegovy.
You took the medication thinking, I'm going to lose weight or I want to drink less.
It was definitely that I wanted to lose weight. But, I thought if I can drink less, even better.
The 38-year-old Arlington, Virginia real estate agent says she gained 30 pounds during the pandemic and was drinking more too.
My checkup last year, I remember telling my doctor I was drinking upwards of 15 drinks a week.
And now?
Some weeks none. Last week was 1, maybe average 3.
Johnston is among many patients who've reported fewer cravings for alcohol while taking semaglutide for weight loss.
What kind of a game changer would this be?
If it turns out that this medication is safe and effective for treating addiction, this would become really the largest and most widely used pharmacotherapy for addiction medicine that's ever been developed.
Kyle Simmons is running one of several clinical trials currently underway to examine whether semaglutide reduces cravings for alcohol.
This region is exhibiting greater activity in this participant.
He says the drug affects the brain and appears to remove the pleasure received from drinking alcohol.
What would you say to people who want to take these drugs now to decrease alcohol consumption?
We just don't know yet whether or not the medication is safe and effective for the treatment of alcohol use disorder.
Johnston says she lost 45 pounds over 7 months and cut her drinking by 75%.
Do you still join your friends for cocktails or go to a bar?
Absolutely, or I have them over and I'll make them a drink, and sometimes they'll have one and sometimes they won't.
A weight loss drug with, for some, a welcome buzzkill.
Ahead, how the pandemic opened doors for caregivers to get the support they need for themselves. That story's next. We close our show with a message of hope and help. There are 38 million Americans who serve as family caregivers, many of whom experience stress, loneliness, and heartache when caring for their loved ones. Barry Peterson sits down with a support group creating much-needed connections for these hardworking providers.
You want some more coffee, honey?
I would love it.
Well, I thought you would.
Jim Meadows spent his 42-year career as a minister helping people.
Sweetie, here's some toast to go with your coffee.
These days, his help is focused on only one person, his wife, Georgie, who has Alzheimer's.
Today is Wednesday.
And now, he is the one who needs help.
Mr. Man.
Yeah?
From support groups run by Duet, a 4-decade-old Phoenix organization devoted to family caregivers.
I think it's harder for men to admit that they need help in any kind of situation.
Does it help caregivers in places like, do you think, even just to know that someone else is going through this like them?
Absolutely, absolutely. And that's what drew me to a support group, because I needed to be with people who understood it.
Loneliness is equivalent to smoking 15 cigarettes a day.
Ann Wheat is Duet's director.
These are unpaid family members primarily, sometimes friends, who have stepped up to the plate to do the hard work of caring for someone who no longer can fully care for themselves.
And then Duet discovered something, that the pandemic that shut down the world taught a lot of us a new skill: how to Zoom. Most of us remember the pandemic as kind of a bad thing, but in this case, it has come up with something good. How did that happen?
We realized that we had work to do to better serve the people we intend to serve. They can't all just make it to us. So we had to figure out how to make it to them, and we think of it as a virtual community for these family caregivers.
Where help could reach anywhere, like the small town of Berryville, Arkansas, population about 5,000, a place with few resources for family caregivers.
Many times it starts to feel like you're in this alone.
Where Cynthia Morin was caregiving for her husband Tom, who had dementia. In Duet, she found a support group, new friends, and advice, all one Zoom call away. So the value of this really is people who have made this journey ahead of you, and they reach out their hand to you.
Yes, absolutely. That makes a huge difference.
It really helped you get through all of this.
Oh, yes, and with sanity, without losing it.
Post-pandemic, we now have trained facilitators in 15 states, in Canada, and on the Navajo Nation, which really showed us that our model works in the most remote, isolated settings imaginable.
It sounds to me like you've developed a way of getting through this cloak of loneliness that surrounds caregivers.
I think we have.
We talked with members of an in-person Duet support group about giving fellow caregivers a virtual helping hand. Among them, Linda Rohde.
So I've touched people all over the country, which has been really powerful, both for me as a caregiver and being part of it, but then also just supporting others in this journey because it's so misunderstood.
Even though it's on Zoom where it's not face-to-face, do you think you still break through into the loneliness that caregivers feel, the people at the other end of that computer?
I think I do, and I think one of the reasons that it's effective is that I'm living it as well. So I feel what they're going through, and I think that's powerful rather than just being an outsider. But being an outsider looking in, I think when you've gone through it or you're living it now, it's amazing. It really does help people in a big way.
Sort of helps to be the soldier in the same foxhole.
Absolutely, yeah.
And Judy Hunter, who shares personal stories about her husband, now in assisted living.
He can't communicate. He starts saying something, and it's gone. My favorite thing to do with him is hugs. I have found that if I give him hugs, he really responds to them. And I respond to them because it's something that warms my heart.
And help comes from more than just fellow caregivers. Duet also sends out video seminars by Dr. Pauline Boss explaining ambiguous loss that many caregivers feel but often don't understand.
The person is physically present but psychologically absent. Their mind is going or missing. Ambiguous loss is a loss that doesn't have closure. It's a story without an end. You don't know how the ending will be. In fact, you don't even know when it will be.
For Cynthia, the seminars and the support group helped ease what haunts many caregivers, fear and guilt.
There were times that I was afraid. Here were other people that were afraid. There were times that I was exasperated and ready to get out. Here were other people who had had these problems too. So it gave me a little more courage to be able to face what might be coming for me.
With help from Duet and her Zoom friends, Cynthia had already learned the most critical lessons of all when Tom died a year ago. That she did all she could, and that she can now go on.
For more stories like these and live coverage of breaking news, stream us right here on CBS News 24/7. I'm Michelle Miller. Thank you for watching Eye on America.